delighted to have the opportunity to talk to Dr. Simon Gabe today. Dr. Gabe is a consultant gastroenterologist at St. Mark's Hospital and is an internationally recognized expert in intestinal failure. So thank you for taking the time to speak to us today. Perhaps where we could start off with, just to add a bit of context, could we ask you to explain about what is meant by short bowel syndrome and why people get it?
There are lots of different bowel anatomies that can exist, but ultimately, patients with short bowel intestinal failure don't have enough bowel to be able to absorb the nutrition or fluids that they require to survive. They therefore need to have intravenous support one way or another. The reason as to why they get it is very varied. Sometimes patients have one catastrophic insult to the intestine. A lot of bowel is removed. It's like a stroke to a patient's bowel. Other patients have repeated surgery, and sometimes they have an inflammatory condition like Crohn's disease. The net effect ultimately is at some point there isn't enough bowel to absorb the nutrition that they need, and they have to have some form of support.
So I'm interested to explore what impact GI diseases have on patients. So here we're talking about a long-term chronic condition. What are the things that patients feel most worried, anxious, or frustrated about?
Most patients are very worried if they have a stoma. It's a high output stoma. Having a stoma is hard enough. If you've got a high output stoma, managing that at night, managing the leaks that might occur, which are effectively a fecal incontinence, the embarrassment that can mean if they're in the shopping centre, if they're out shopping, is really quite hard to manage. I don't think patients are that fearful of it until it happens, and then it can be emotionally very distressing. Patients can get depressed as a result of those features. Lack of sleep. When you've got your feed running at night, you often have to get up to pass urine, and that causes difficulty sleeping, and that's a problem. Patients often have a thirst. If they're chronically dehydrated, to be thirsty all the time, wanting to drink but knowing you can't drink is very tough.
So, from a physician's perspective, what is the most important goal when it comes to treating these patients?
So ultimately, it's to try and help patients lead as normal a life as possible. So sometimes so that they don't stand out. For some people, it's being able to be at home, to get out, to go and do the shopping, to be able to work again. For others, it'll be to get on holiday, to travel, and even pregnancy for some patients. That's what they really want to aspire to be able to do. The important thing is to tailor it according to every patient, for them to realise that most things are possible. They're just a bit more complicated.
The medical treatments currently available for short bowel syndrome, is there still a gap and a need for better treatments? Or are patients overall satisfied with the treatment options available?
So the overall treatment paradigms include the standard of, what is the standard of care? And the standard of care involves treatments to decrease output for patients with a short bowel. And these are all medications one way or another, and dietary advice, things like that. Intravenous nutrition then is supportive one way or another. But the next bit where the gap is where the emerging treatments lie. And this is in the growth factors, intestinal growth factors. So GLP-2 analogues, such as teduglutide, are the ones which show the most promise for these patients. Patients are really excited about this as a treatment. The reality is that at the moment this is a very high cost treatment. And I'm excited actually in time that there will be lower cost, good treatments which are growth factors for these patients, and that we'll know a lot more for these patients. In fact, overall, I think this is quite exciting times for these patients, to know that there are a whole load of treatment options, when about 10 years ago, there really weren't. So there's a lot of promise ahead for them.
So for companies that are developing new medicines, such as Sosei Heptares, are there any aspects that could be addressed better with future therapies? And what do you hope to see that will be a game changer and make a true difference to the quality of life of patients?
Combination therapy, sequential therapy, putting GLP-1 and GLP-2 analogues together. GLP-1 analogues will affect motility of the bowel. GLP-2 will be trophic. But there are plenty of other growth factors and other peptide areas that could be developed, and using this as combination therapy ultimately is probably the way ahead. In terms of the game changer, that's simple. Realistically, we need to get patients off parenteral nutrition. People who are dependent on intravenous support need to get that stopped. And anything that will achieve that will be important. It's the game changer.
So lastly, what is needed for a better awareness of these diseases to help support the patients who are living with GI conditions?
It's really important to try and take the stigma away from some of the problems that people have. So campaigns maybe to normalise or help people understand about stomas, about having tubes that go into veins, that go into the bowel. These are all really helpful things to raise awareness.
So Dr. Gabe, thank you very much for your time to talk to us and for sharing your insightful views. We wish you all the best and success on this very important journey improving the lives of these patients. Thank you.